we have the best person who could educate us through all these experts, and Dr. Priya would be leading the show going forward. So I hand it over to Dr. Priya Chokalingam.
Dr. Anantraman, with several of your patients having attended and participated in cardiac rehab programs, what are some important differences the program has made to your patients' lives, both in the cardiac health as well as in the overall health?
Firstly, thank you, Priya, and thank you for starting this Heartonomics series. It's a much needed one, especially in India, because we are very much into the interventional field. But in terms of rehabilitating these patients physically, mentally, and getting them back to their normal selves, very little is done, and I think you've taken a great initiative. So much appreciated. Now, in terms of your question, obviously, where I have kind of spent 20 years and where I have spent in the last 5 years, we are spoiled for choices in UK because you have specialist nurses for everything. You have cardiac rehab nurse, secondary prevention nurse, arrhythmia nurse, heart failure nurse. So whatever you need, when a patient gets through into the hospital CCU, immediately the admission itself, the cardiac rehab starts, and the patients are seen. Within 24 hours of the procedure, they are taken in, and by the time they go home, the first phase is completed. Now, when we see them at 4 weeks or 6 weeks follow, they are almost back to their normal selves. But here it is completely different. And especially during COVID time, we had a lot of difficulty. We had to adapt to a new norm, and the surgeries has to be kind of adapted as well. Fortunately, I had a fantastic colleague, Yusuf was there. So we've done a lot of hybrids and lima to LAD and then the stenting to others. This meant that these patients did not have the option of the usual physical cardiac rehabilitation programs. I think we'll be talking more of that in the sort of next few minutes. But clearly these patients had a big change in terms of their confidence building and also their exercise, as well as getting them back to their normal work. The cardiac rehab has played a huge part, both physical and mental rehabilitation. So that has been the major change, especially in the last 2 years during the COVID time.
So this question, Dr. Sengatuelu, is to you. With the age of first heart attack actually declining rapidly, and actually even more and more older senior people requiring complex cardiac procedures, do you think cardiac rehab has a role across age spectrum? Could you elaborate on that?
Good evening to all of you, and happy to share this program with all of my colleagues, Dr. Anantraman, Yusuf, and Dr. Priya, especially for organizing this wonderful program. So as you said, I think cardiac rehabilitation, as Anantraman pointed out, is one of the important aspects I think we should follow as part of our regular management of these patients. And as you said, rightly, we are seeing more of younger patients with heart attacks, and very often they come with sometimes with late presentation, and also, as you said, nowadays we are seeing in all age groups, and also when you see elderly patients even in 80s and 90s, particularly with valve diseases and needing for even sometimes transcatheter valve replacement and such procedures. All of these patients will need definitely need cardiac rehabilitation. Let me explain why. So, as for the people to know, cardiac rehabilitation is a evidence-based care where education is imparted, education is given on aspects of exercise, diet, counseling, which is a part of the management. Though as an interventional cardiologist, we have a key role in attending to emergencies or doing the elective procedures. I always tell my patients the role of cardiologist is only 20%. 80% is in your hands, because a disease process should be arrested. Whatever we treat or repair, unless you prevent further progression, you are going to come back again to us. So the whole idea is to make sure you prevent the disease. And for that, I think the cardiac rehabilitation plays a very, very important role. And in this aspect, every age of the patient, regardless from younger patients as well as any patient, regardless of the etiology of heart disease, like whether it can be a structural post-TAVI or it could be a heart attack patient, they will need customized protocols for prevention, secondary prevention. So, secondary prevention by means which I mean, if you already had heart disease, how do you prevent further recurrence or further progression of disease? That is what is secondary prevention. So for secondary prevention, we have to make a strategy or like tailor-made programs, customized, which I think the Priya really offers, and I have seen myself how she tailor makes the program, and that will help the patients to plan their kind of activity. For example, a young patient who is 45 years old who has had a heart attack with say a heart attack which is damaged muscle comes late and maybe has a damaged myocardium with about 40% ejection fraction and maybe has symptoms of occasional heart failure, then Priya will be able to customize a program suitable to that patient with the limited gradual exercise suitable to that patient. Similarly, if you take another, say, example, a 75, 80-year-old man who is active and fit, has a aortic stenosis and transcatheter aortic valve replacement, he may be fit with the normal LV function, still he can physically be active. So he can devise an exercise program considering his comorbidities and the age, and also devise a program not only on exercise, but on the diet and the counseling and how the lifestyle should be followed. So I think this is a key aspect which I always tell my patients that this is 80% of the treatment, whereas 20% is what we can do. So thank you, Priya, for organizing this meeting again. Thank you.
Thank you for those wonderful words with case examples, Dr. Singhattuvel. As we've heard from the interventional cardiologists, their verdicts. Dr. Yusuf, may I turn to you I mean, you have extensive, vast experience in both conventional as well as minimally invasive cardiothoracic surgeries. So could you enlighten us on how do you think cardiac rehab is helping your surgical patients? And when do you think a post-operative patient should actually begin with cardiac rehab?
Good evening, Dr. I thank you for organizing this evening, especially with the two of my colleagues who strongly believe in cardiac rehab as well. Thanks to Anantharaman who introduced me to you. Because initially when I moved back to India, this is something we were lacking. I think you have been doing it well and more appreciable is during the COVID time and even now. Because a lot of our patients come from far and even abroad as well, far and beyond. They're not necessarily from Chennai where they can come in person to attend the sessions. So these online sessions have been really helpful. And as Dr. Anantharaman and Dr. Singhattuvel said, so surgical patients need a longer term rehab compared to intervention because it's quicker recovery. Although we do minimal invasive, they need longer recovery. And the best thing is, as Dr. Singhattuvel quoted, you tailor make the program, rehab program. That has been really helpful. During this last few years, which I have seen patients, they have been very been beneficial or benefited by, say, either minimal invasive or robotic patients who recover very quickly, as well as the elderly and the severe heart failure. Most of these open patients that we do are very sick patients. Others go into minimal invasive procedures. Those patients being catered to their individual needs has really made a difference. Not only in providing a program as to say what has to be done, it's also answering those little questions which they don't feel comfortable calling us for. So that's been a big difference.